The other thing that somebody sent me, I guess, Brian, we're just not going to get our guest this morning, huh? Darn it. All right, guys. Well, we wanted to give their perspective. And so if we can't get them today, we'll have to try for it some other day. But someone sent me this really interesting research document from the Swiss Policy Research. And what's interesting to me is it looks like they do translation in about, 50 different languages. Maybe not 50, 25 anyway. Unfortunately, they also have a translation in English. And I just thought you might be interested in looking this up yourself. So it's swprs.org, because you guys are asking me for some pretty hard data on how does this compare with other types of illnesses? How does this compare with other death rates? And they have a pretty good summary based on the latest data, and it is all sourced, so you can go through and you can click through and look at all of the sources for yourself. But let me just give you a few of the examples that they have here so it can put it into context for you. So, and for those of you who listen to me and have listened to me for the last 5 months, I don't think any of this is going to come as a surprise to you. But it's nice to see that the things that I'm telling you are being observed and validated by a major international think tank. Number one, according to the latest immunological studies, the overall lethality of COVID-19 is about 0.1 to 0.3%, and it's thus in the range of a severe influenza. So it is worse than a typical flu, but there have been prior flu seasons that have been this bad, and I've talked to you before about a couple of them: the Hong Kong flu, as well as the flu in flu in the 50s and the flu in the 60s. Number two, for people at high risk or high exposure, including healthcare workers, early or prophylactic treatment is essential to the progression of the disease. There are some other nations in the world that do use at least 4 or 5 different types of therapeutic drugs. We don't approve them here. I'm not entirely sure of all the reasons why, but we have not made we've not made decisions to go down a similar track. So if I can do some shows on what those early prophylactic treatments look like, I'm happy to pass that on. But that seems to be pretty important. In countries like the U.S. and the UK and also Sweden, without a lockdown, overall mortality since the beginning of the year is in the range of a strong influenza season. In countries like Germany and Switzerland, overall mortality so far is in the range of a mild influenza season. So there has been variability between different jurisdictions. So that also goes to the issue of how the disease is managed. That's one factor. Number 4, in most places, the risk of death for the general population of school and working age is in the range of a daily car ride to work. The risk was initially overestimated because people with mild or no symptoms were not taken into account. That's part of the reason it's important that we continue to see this ongoing testing, because when you find the mild cases, it puts the death rate into perspective. And there are a lot of mild and asymptomatic cases. In fact, number 5, up to 80% of all test positive persons remain symptom-free. Even for those of you who are in the older age group, even among 70 to 79-year-olds, about 60% remain symptom-free. About 95% of all people develop at most moderate symptoms. So it's the 5% that you end up with an extreme outcome. And that's why I have always taken the view from the very beginning that you have to focus on finding that 5% and giving the protection. Number 6, up to 60% of all persons may already have a certain cellular background immunity to the new coronavirus due to contact with previous coronaviruses, i.e. cold viruses. The initial assumption that there was no immunity against the new coronavirus may not be correct. We're going to talk about that at 10 o'clock today to find out why it is. When you think about that, that just seems to make sense, right? You look at the cruise ship where they had 4,500 people on it, in close quarters, in tight corners, even in the cases where husbands and wives were sharing rooms together, and only 700 people ended up contracting the virus, which means somewhere around 80% did not. Why not? Did they have some kind of immune fighting ability that fought it off? They've been looking at T cells as a potential for that if you've been exposed to a similar virus in the past, your T cells are juiced up and ready to fight it. So we got to look more into that. Also, the median age of the deceased in most countries, including Italy, is over 80 years. It's actually higher in Sweden. Everybody points to Sweden as, oh my gosh, we don't want to follow them. But the median age of death there is 86 years. And only about 4% of the deceased had no serious preconditions. In Alberta, it's been 6%. So that seems to be consistent, that data from around the world. The age and risk profile of death thus essentially corresponds to normal mortality. This other issue, this is not unique to Canada. In many countries, up to 2/3 of all extra deaths occurred in nursing homes, which do not benefit from a general lockdown. Moreover, in many cases, it's not clear whether these people really died from COVID-19 or from weeks of extreme stress and isolation. It's an interesting observation, isn't it? How many of you have told me how much despair your loved ones are in nursing homes because they haven't been able to see you? And so can you really separate out the deaths of despair in nursing homes versus some of the ones that are categorized as COVID? There you go. So it goes on. I can't read them all. It goes up to 30 different fact points. And if you are interested in looking at it for yourself, as I say, I'm always very keen on encouraging you to read as broadly as possible, go to sources, and then you can come to your own conclusions about where your level of fear should be. I've been a bit surprised to see that the polling continues to show an increase in the number of people who are fearful of getting this disease. I mean, I'm kind of the opposite. The more I find out about it, the less panicked I am. So I think information is power. Alrighty, guys. People are asking again for that website. It fully referenced facts about COVID-19 provided by experts in the field to help our readers make a realistic risk assessment. So it's put together by a doctor, and it is the Swiss Policy Research. So SW, just remember that for Swiss Policy Research, PR. S. I don't know what the S stands for, but anyway, that's what it is. It's swprs.org. And if you look up Swiss Policy Research just on the Google, you might be able to find it there as well.
All right, let's read the article that Danielle was reading on air. This is the article from Swiss Policy Research. The URL is on the slide. We can see that she's correct. It's been translated in many languages. This doesn't mean it's correct information. It's just available in many languages. And I don't know why she neglected to mention this weird quote. The only means to fight the plague is honesty. I'm not sure how many scientific studies start with quotes like this, but it doesn't have any attribution at all of who wrote this. But she's saying this is a respected think tank, and this paper was written by doctors. Now it's going to take too long to get into all 28 or 30 points on this page, but let's drill down onto one that Danielle cites. Point 2, right, the one that she read on air. For people in high risk or high exposure, including healthcare workers, earlier prophylactic treatment is essential to prevent progression of the disease. So if you follow this link, it doesn't go anywhere except another page on the same website, this Swiss Policy Research, and the treatment protocol that they go over is hydroxychloroquine again, right? So once again, Danielle Smith is plugging hydroxychloroquine, right? This is her own source, right? She tweeted this. She tweeted that hydroxychloroquine was a cure weeks or months ago, and now she's citing a paper that on some website with unknown authors that is saying that medical workers, like even healthcare workers, should be taking this prophylactically, which doesn't make any sense at all, and is not any other medical profession. No, there's no medical professionals that are doing this or suggesting this. So let's get into where is this website from. So if Danielle bothered to do a little bit of research about where her sources are, you can see the Swiss Policy Research is a multi-language website launched in 2016, which describes itself as an independent nonprofit research group investigating geopolitical propaganda in Swiss and international media. And it says quite clearly, based on its largely conspiratorial contents and its cherry picking of questionable scientific studies, it has been categorized by some as anti-establishment propaganda site. The editors of the website are unknown, but they state that SPR is composed of independent academics and receives no external funding. I mean, we don't know if these people are academics, but I mean, it's just an anonymous blog. Contrary to what the name Swiss propaganda, like this is the original name, Swiss propaganda research, I'm not sure, it seems to be a politically loaded term. It has been speculated that the site might not actually be managed by people from Switzerland. So they don't even know if these people are necessarily from Switzerland. So here we see, this is what Wikipedia has on them. swprs.org. This is the site that Danielle read on air. We don't know who edits it. We don't know who owns this. We don't know anything about these authors. There's no doctors cited on this paper. The paper uses other publications on the same website as sources. It's just ridiculous. And then go on, if you read down in the criticism section of Wikipedia, it says the site has been criticized for spreading conspiracy theories, and especially so during the times of the COVID-19 pandemic, when it's a source of misinformation and disinformation internationally. The SPR has been categorized by some as a tool of propaganda. Again, we don't know who, but if it's blogging hydroxychloroquine, we can guess. In 2017, a University of Zurich report on the media in Switzerland analyzed 6 of the most discussed alternative media, including SPR. Danielle Vogler concluded that SPR resorts to conspiracy theories and its contents were mostly pseudoscientific. Another person in Europe presumably wrote a critique of the website, saying the website Swiss Propaganda Research, now it's Swiss Policy Research, they've changed the name again, assumes that the Swiss media does what itself does, feed the readers with questionable information. He also suggested by language used on the website that the creator is not likely to be from Switzerland, which is interesting. We don't know who created this website. And then the professor of journalism and media management at University of, you can read it, considers the articles on SPRS as themselves propaganda rather than being serious research. He has noted that the anonymity of the websites creates doubt of the reliability and authenticity of its research, particularly in a country such as Switzerland, which has full freedom of press. There you go. Danielle Smith is just reading a random website, waiting for her guest to come on air, and then saying that a doctor wrote it and it's a reputable think tank. But she has no idea who actually wrote this information. She has literally no idea who wrote this. She has no idea who owns the website. It's not a think tank. It has zero reputation. This is complete bullshit.